Elsie Nandwa is battling a flurry of autoimmune disorders. This is a condition that occurs when your immune system mistakenly attacks and destroys healthy body tissue. It is incurable but manageable. The high cost of managing the conditions of patients living with autoimmune disorders is a source of concern for rheumatologists. Since cost is a huge impediment in the management of autoimmune disorders, patients with the disease are crying for the National Hospital Insurance Fund to step in. However, they know that this requires a multi-sectoral approach involving the government. Rheumatologists point out that other than cancer, patients with kidney disease have special consideration from the NHIF. In contrast, those who have autoimmune disease don't. To make matters worse, even private insurance firms shy away from such patients. The fight to get autoimmune diseases recognized and covered by NHIF is being championed by patients and doctors alike.
There are patients who, for example, have cancer or have kidney disease. They have special consideration from the national insurance. But patients who have autoimmune diseases don't have such consideration.
Dr. Eugene Genga, also a rheumatologist and lecturer at the University of Nairobi, shares similar sentiments.
Some of our drugs that we use, like the infliximabs, some of them are used in the cancer, and cancer they get them back, and our patients also receive the same treatment.
To make it worse, these patients who have autoimmune diseases, even the private insurance tend to shy away from them. So you find that the bit that they're insured for is very little that can take them through the course of treatment for the year.
Elsie Nandwa is one of those fitting the description of these doctors who deal with musculoskeletal health.
I have ankylosing spondylitis. This is an inflammatory for the spine. The spine discs fuse. The condition is very bad because it affects the spine, the pelvic bones, and even the jaws.
Ankylosing spondylitis belongs to a group of arthritis. So arthritis is basically a disease that affects joints. So it belongs to a group of arthritis which we call seronegative arthritis.
It's believed that ankylosing spondylitis is an autoimmune disorder. This means
the body's defense system is unable to differentiate between the normal cells and the germs, so it attacks it.
The characteristic of this broad group of diseases is that they tend to affect the axial spine.
My back was very bad. I could even not move in the bed. I could do nothing. It was so stiff, very painful.
The back is supposed to be flexible. What happens is it lags, especially on the side, okay, and also the back here. So over time what happens, because of the inflammation and everything, these bones actually fuse and join. Ideally, you should be able to do what? Move. Okay. When you have ankylosing spondylitis, it is fixed. So it means if somebody was to move, they have to move the whole what? Body.
If left untreated, then patients would suffer serious disability. So these are the kind of patients you see with a stooped back progressively, and that really hampers the activities of daily living.
ankylosing spondylitis is often accompanied by multiple illnesses.
I also have fibromyalgia. It's also painful. It affects the joints. And I also have the hyperprolactinemia. These are about the breasts. So the hormones, the prolactin levels are high at times, so I lactate.
The management of these concurring disorders has taken a heavy toll on Nandwa. Endless appointments with medical specialists are the norm for her.
I see my rheumatologist every 2 weeks. I also undergo psychiatric sessions. I also have anxiety disorder, and it's not very easy to accept the conditions. So I'm still undergoing psychiatric counseling.
Rheumatologists know where to trace the origin of this debilitating ailment.
In ankylosing spondylitis, we tend to see a genetic aspect to it. So it tends to run in families, usually commoner in men than in women. The onset tends to be usually below the age of 40, and it's a very progressive and destructive disease.
The major challenge we have with the management of this disease is that the drugs that work best are very expensive.
There is a reason for this.
The technology used to make this drug is very high-tech technology. There are certain types of drugs we call those by the biologics.
The biologics are very complex proteins that are cloned, actually clone them from the human body. And basically what they do is, you look at the science for the disease, there are certain pathways that have been found to be very, very influential in the science of the disease. So one of the pathways, take for example, is called tumor necrosis factor, which is TNF. So there are drugs that can actually block that pathway, and by blocking that pathway, we're able to control the symptoms.
Nandwa is no stranger to hospitalization.
After every month I'm hospitalized because of the infusion. That is if I'm supposed to go for the infusion. Yeah. Huh? Ngoja. Oi. Last year on 11th of July I was hospitalized. I stayed there till 26th of August. It was so bad staying in a hospital for 2 months. It's tiresome, tired of sleeping because you can't do anything.
She's been depending on her mother's insurance cover until the age of 19 last year.
The bill was 569,000. I was so stressed, I cried because it's very obvious you'll get stressed over that because you're hospitalized. The insurance is not going to pay the bill, so you're supposed to chip in cash.
We have groups of patients who are needy. How can for example, the National Hospital Insurance Fund come around and be helpful to these patients?
Nandwa couldn't pay the bill in time. As most hospitals will do,
I was detained for a week. That is so long. The more I was detained, the more the bill was piling. 6,500 shillings every day for the extra days I was there. My worry is how I'm going to get the next infusion, the next infliximab infusion for the spine, because the infusion is very important and we're supposed to pay cash. I don't know how.
Infliximab, depending on where you go, per 100 milligrams, that's how it comes. It can range between 80 to 100,000. So meaning for somebody, usually we dose 3 to 5 milligrams per kg, it's about 3 bottles or 4 bottles. So each bottle is about 100,000. So you can spend as much as 300,000, and that's 400,000.
In the meantime, Nandwa has to continue with a regular cocktail of oral medicine. Whether she'll afford the infliximab medication is shrouded in uncertainty.
It's a 4-hour infusion. So usually the dosing that we give on day 0, then after 2 weeks, and then after 6 to 8 weeks. So after the first dose, which is 0, and the 2 weeks, is every 6 to 8 weeks, every 6 to 8 weeks.
Temporary relief is gained through many physiotherapy sessions. She goes to Nairobi West Hospital. Her physiotherapist is Gladys Mora.
Elsie sometimes misses her sessions because the insurance has not approved so many sessions for therapy. Like now she will need so many sessions. You find that the insurance has given them like 2 sessions or 5 sessions. And then next they are told insurance is not going to cover this.
Physiotherapy helps so much because when the back muscles are tight or when the back is stiff, it helps loosen the stiffness.
Elsie, imeisha. Nenda another step.
That step is soft tissue manipulation. All these physiotherapy sessions incur some costs.
Cost is a big impediment. That's a big factor that we really need to address. And issues around cost are issues that need to be discussed in a multi-sectoral sort of approach. And I think in this we cannot avoid having such discussions with government authorities and so on.
When I want to give her support, maybe a brace for the back, a brace for any joint that she's feeling like now I can't walk. Okay. So you find that the cover does not approve that she be given that item. So due to financial strain, she might miss some of these things that are helpful to her because the insurance will not cover it.
Nandwa is worried that her immunity is compromised.
The infliximab itself, it's an immunosuppressant, so my immune is very low. So I'm not supposed to be lousy, walk around in matatus because I'm at risk of getting the COVID-19.
What we need to lobby is for patients with autoimmune diseases also to be brought under the umbrella of this special coverage that patients with other illnesses get.
I've been trying to talk to my patients, start like a support group, because if you look in the West, that's what has really helped them a lot. Because the support group means what they come together, they can lobby the government as a team, but if the patient raises the concerns, it helps.